Well, I've known you and your wife since 2009, I think, when I started taking care of you. You went downhill really, really fast when you got, well, actually, before you got the diagnosis of the autonomic disorder. And then when you started coming in with that, then, I mean, I wasn't sure, honestly, how much longer you were going to live. And it was really, really scary. Now, I guess you kept having low blood sugar. I mean, you always had low blood sugars just because that's the nature of having type 1 diabetes. Um, but they were much more severe once the autonomic diagnosis was made. And I guess historically, when you look back, you have to understand what type 1 diabetes is and why the lows are so significant. So when you have type 1 diabetes, your body can't regulate your blood sugar at all. You make absolutely no insulin. And that's very detrimental to your body because usually when you make no insulin, then you also don't have the response to the low blood sugars either. So a normal non-diabetic person, it's like a teeter-totter. They have a regulation between sugars and insulin, but you don't have that anymore. So the longer you have diabetes, the harder and harder it is for your body to regulate that. So that's why it's important for you to check your blood sugar 4, 6, 8, 10 times a day, even more than that. So over time, your body, as it loses that ability to regulate those blood sugars, then you start having higher highs and lower lows that your body can't sense anymore. So the highs are really problematic long term because that's where all those complications come in. The loss of eyesight, the kidney damage and dialysis, the heart attacks, the strokes, the amputations. So that's long-term effects. And that damage can build up over time, but the lows are dangerous now. So that, if your blood sugar drops to 50 or 60, it's not that severe. But if your blood sugar drops to 30 or 40, we're starting to get very dangerous. And for most people, if they start getting below 30, they could go into seizures, coma, and even death. So, in the early stages of diabetes, you might be able to sense that just fine. Your blood sugar starts to go below 60 or 50, you'll start feeling weak and shaky and jittery and sweaty and just start having this sudden sensation of anxiety that you've got to eat, you've got to do something to bring this blood sugars up. But over time, the more high highs you have and low lows, and your body can't sense that anymore, then you lose all ability to know when your blood sugars are low. And we call that hypoglycemia unawareness. You can lose your sense of knowing where you are, what you're doing, who you are. You can not be able to call 911 for help, and if you do, you wouldn't be able to talk to them and tell them that you need help. So it can be extremely, extremely serious, even fatal, if you go into a severe low. I've got several patients that have had to go to the emergency room. Their spouses have had to wake them up in the middle of the night because they were just sweaty, and they didn't have any of these other sensations. Their spouse woke up, they realized that they were sweaty, they woke them up, and their blood sugar was 18, 22. If their spouse hadn't woke them up, they might have died. So it can be very serious. So that's where we've turned the corner into all of those things where that was already starting to happen with you. And then we got the autonomic diagnosis. And how that totally changed everything is that the autonomic nervous system is the only source of defense against low blood sugars. So that's how the autonomic system kicks in and makes you weak and shaky and jittery and sweaty and nervous and have that innate drive to just go and eat. Once you get that diagnosis of the autonomic failure, the nervous system failure, then you don't have any sensation at all most of the time. So where we were already dangerous from having lows anyway, then we get this autonomic disease that not only can you no longer sense the lows, but the autonomic nervous system also controls heart rate and blood pressure. So if the autonomic nervous system is not functioning properly, not only can you have drops in blood sugar so low that you can't sense it, you also can have drops in blood pressure, heart rate, and pass out just from that. So they a lot of times will give you medication to keep your blood pressure up just so that you won't have that happen. So now we've got a whole system of problems that you have because of the autonomic nervous system disorder. Then we enter in the seizures. So now we have the diabetes with the low blood sugars we can't sense. We have the autonomic nervous system disease that makes us have lows that we can't treat or that we can't take care of with our own body. And now we enter in the seizure disorder. So for you, from early on, I took care of you, you would have multiple seizures a month. To where now, fortunately, with this diet, it's a lot less. But the problem with having seizures is that it could be a seizure from a low blood sugar, or it could be just one of your regular seizures. But if someone who's taking care of you doesn't know the difference, then it could also be the difference between life and death, because if it's because of a low and we don't treat it, then that could cause you to have a loss of your life because of the lows. So when we put all of that together, we've got a very complex system that makes it very, very challenging for caregivers to know the difference between what's going on with you. Well, all you have to do is see the video of Rex. He's a sweet, sweet puppy. But, I mean, I think if I was looking at the situation, especially if I didn't know, if I was, looking at that for the first time or looking at your story, knowing that there's an animal out there who's that smart, who can be trained not only, because most dogs are only trained to do one thing, only sense the lows, or only sense the seizures. This dog has been trained already to sense both. And that is just amazing that a creature that can't speak, can sense that and has commands and can tell you. And I've seen the dogs, go and get the bottle of juice and take it to the person and, nudge them and make sure that, they're drinking it. It's incredible when you see these dogs in action, when it's actually in a critical situation. But if I didn't know everything and I was watching that for the first time, I truly wouldn't understand it completely. But what would encourage me is that these dogs are absolutely amazing, and they're being used to potentially save the life of a person who still wants to be functional. Some still want to try to work. Some still want to do all of the things in life that the rest of us get to do that they wouldn't get to do otherwise. And if you knew nothing else and you just knew that would be enough. But to know the backstory and to know how you declined so much over a couple of years to the point where I really wasn't sure to whether you were going to make it, and then to turn around and see that, things are getting better, but they're still very, very serious. And I would encourage anybody who's even remotely touched by that story to do whatever they can to help, because this dog is precious, and he can save a life. And, of course, that's what I do every day. I try to save people's lives, so I have a soft place in my heart for that anyway. But it encourages me that we have organizations in place that train these dogs to do this. So I would absolutely do whatever is necessary, whatever anybody can do to help, because it can make all the difference in the world.